Hey everybody, so I'm going to be here today talking to you all about executive power, the structure and function of such a thing. There's a lot of conversation happening right now, obviously with the COVID-19 outbreak, about what those who are in charge need to be doing, should be doing, are in command of doing, right? So I'm going to focus today on the separations at the federal, the state, and local level, and how those persons can more adequately and effectively and efficiently help us through this this pandemic, right? So I'm going to talk about it kind of like it's a natural disaster, because I think in many ways that's really the only schema that we have for this. We have this understanding of natural disasters as something that we all have to come together and deal with, something that we have very little control over. And so I think it's kind of just a good baseline of how to view this situation. So, from the get-go, the federal government needs to be in charge of coordination and communication efforts. This comes in a lot of different ways. Obviously, we pay 20% of our taxes, sometimes more, sometimes less, to the federal government. That means 1/5 of our income literally just goes to the federal government to disperse as they see fit. Now, the executive branch does not have control over how this money is distributed. That's the legislature. That's our Congress people. But that doesn't mean that they don't hold sway over those groups of people. Obviously, that's a big part of being the president, is being the commander. And obviously the vice president as well, who is a member of the executive branch, presides over the legislature. So again, these are not the money part of this, which is really the biggest part of this, is not completely controlled by the executive branch, but obviously they have a large sway. They have the power of veto. So cash is kind of what I'm going to talk about right now, because cash is such a huge part of the communication and coordination effort that needs to be taking place on a federal level. Again, I'll talk about state and local later. On a federal level, we need to be sending money to the medical professions. We need to be line iteming it for these groups of people. In addition, we need to be funding those who are most vulnerable among us. 3/5 of the United States citizens can't afford a $1,000 emergency expense, and I'm included in that. I mean, most people are not prepared for something like this. Most people can't go a month without getting paid. 2 months, 4 months. It took Wuhan province 4 months from their first incident to finally getting past this. 4 months. So imagine 4 months without being paid, and the government telling you basically that it's just not their job to deal with it. So that's what we need to not happen. The coordination between countries needs to be done, obviously, at the federal level. There are many countries who have much quicker testing programs. They're already working on vaccines, and I'm not saying that we can't come up with our own, but we need to be working alongside them in the medical profession. In the research community, we need to be listening to the World Health Organization. It's not just the CDC, right? Because there are people whose job it is to know more than me, and then you, and then the president, okay? Then the governors, then the mayors. It's literally what we pay them to do on a global level, is to understand the concept of a pandemic better and more fully than I, average Joe, do. Okay? So, again with that, and again, we're going to talk about money on the federal level, because that's where all of our money needs to be coming from. That's where our funding needs to be coming from. The United States government spends more than half of our GDP on, what is it? The military. Now, I'm not saying that we need to be sending tanks down the street, but I'm just saying, if we send tanks down the street with food for everybody, is that really the worst thing that tanks are going to do? And that's kind of silly and a little grandiose, but But that's really the idea, right? Is like we've got all of these people. We've got the National Guard. We've got the Army Reserve. We've got the state militias who are ready and available to protect and serve. Why are we not utilizing them? And again, it always just comes back to money. It's like we can employ the private sector, and I do think it's the federal government's job to start employing the private sector to be making masks, to be making respirators, to be making the whatever it is that we need. I don't know. Let's ask who. But it's important that we keep focus and we keep pressure on these lawmakers and these people in power to give us what we need. Okay, give us back our money, like so that we can pay our rent and pay our bills and dig ourselves out of student loan debt for another month, okay? So that's kind of the federal level. So the federal level is going to be coordination and communication between countries and between the states, okay? Kind of making a big umbrella that we can all get under and say, this is how we're gonna tackle this. And then moving down into the state. So the state should be given money from the federal government to then distribute amongst its localities. I'm going to talk about specifically here in Missouri because that is what I know. Lieutenant Governor. The state knows better than the federal government on a smaller basis what is going to be best for its citizens, okay? Again, we're talking about that state guard. We can be talking about knowing here in Missouri, like St. Louis and Kansas City, like those are two big places that we need to watch out for. We need to be able to more heavily guard against an outbreak. There's just fewer people in the rural areas. And obviously in Missouri, like we have a huge rural population, the entire bottom half of the state, right? So they're going to need different things in those rural places than we're going to need in the cities. And it's the governor's job to know how to distribute those funds. Okay. So in the rural cities, we're going to need things like food programs. Rural populations are much more impoverished than those in urban populations. I think in urban populations we're going to need more rental stipends. We're going to need money to pay our rent. We're going to need to make sure that our utilities are cared for. And we're going to need more physical barriers because there's just more of us. It's the government's job, it's the governor's job to know where to distribute those funds to, okay? And then again, with the first responders, with the state guard, we have emergency funds at a state level. It's just not, to the degree that the federal government has. So again, we need to be utilizing our state emergency funds. We need to be talking about, limiting contact. The social distancing only goes so far. What we need to do is limit contact unless necessary. And that's really what the state is going to know a little bit better, and even kind of stepping down one more into the local level. And so the local level, so our mayors and city councils, so this